Welcome to Healthcare IT Today. I'm John Lynn, together with my colleague and friend, Colin Hung. The world of technology and healthcare are ever-changing in new and novel ways. That's why we love this stuff so much. So join us as we discuss the latest healthcare and health IT news meshed together in new ways, which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. On today's episode, we'll be doing a preview of the HIMSS 19 Annual Conference in Orlando. Be sure to follow the show on Twitter at the hashtag HITSN and our personal accounts at TechGuy and at Colin_Hung. Plus, check out all of our HIMSS 19 activity at healthcareittoday.com. So, Colin, you ready for HIMSS?
Yeah, I can't believe it's here. I mean, it's early this year in February.
I know, it's just around the corner. I think the earlier start time has thrown off everyone's schedule, including my own, including all the vendors. And, it'll be interesting to see how many CIOs show up and said, oh, crap, I didn't have time to plan what I was going to do.
It is quite the start to the year where it's so close. You basically only have like 4 weeks to go, from the beginning of the year, basically until HIMSS. So now we're just, not too far away from it. And yeah, it's a crazy start to the season.
Yeah, and it's hard to do with the holidays, right? I mean, you just can't plan over the holidays, so you had to either do it before the holidays, which felt really awkward, or crunch it in. So, it'll be fun though. I mean, everyone plans for it year round in some cases, so I think we'll be okay.
I think we'll be good. It always ends up being a great show and a great event. So always look forward to catching up with everyone there. But on today's episode, so here's what we're going to be talking about. So first, we're going to be talking about what you and I think is going to dominate the HIMSS exhibit hall floor. After all, it is the size of about 3 football fields. There's a lot of activity going on. So we want to know, we're going to debate whether which of the 2 ideas we have are going to dominate. Then we're going to talk about a particular tweet that actually the HIMSS folks sent out just around the AI, percentage of people that believe AI is really going to be helpful for population health. So we'll riff on that a little bit. Then we're going to give some very practical advice to 2 sets of folks. We're going to give some advice for people who are attending HIMSS, and then we're going to give some advice to people who are exhibiting at HIMSS. And with only a few weeks to go, that's hopefully people will be able to take some of those tips and use them at the big event. All right. So first up, John, let's talk about what will dominate the HIMSS exhibit hall floor.
Yeah, I think some people might think I'm a bit of a pessimist, which I'm not. I'm an optimist by nature, but honestly, I'm not sure we'll see that much change. So I don't know if that's even a prediction, but I think it'll be interesting to see what's there and what's available. I hope that we see more patient engagement solutions and solutions that really involve the patient. But I'm a little scared that that's just not going to happen. I saw a research study that's going to come out around HIMSS time, so you can check out the research. But it talked about the importance of patient engagement and patient experience to these healthcare organizations. But then there was this disconnect that said, okay, and so we're going to improve our patient portal, which I describe as the death of patient engagement, right? The patient portal is the death of patient engagement, at least as is. And sure, they need to be improved, but let's go beyond the patient portal if we really want to engage patients. So anyway, I'll be seeing is there real movement to engage the patient and to listen to the patient, or are we just paying it lip service and improving our patient portals?
Well, I can't argue with you there, John. I think, I hope to see that as well. I hope to see, at the show, a little bit more around APIs, actually. Sorry, I should say I'm expecting to see a lot around APIs just because of all the changes that are happening with regulations. I think there's going to be a lot of emphasis on, hey, we have APIs, or we're announcing new APIs, or we have the capability of utilizing other people's APIs. So I think like AI was last year, I think APIs are going to be sprinkled upon everyone's booth. We're going to see that all over the place. I'm hoping to see some meaningful movement towards interoperability. I say that every year. And every year I hope we get a couple
Hope is not a strategy.
Hope is definitely not a strategy, but I'm definitely looking forward to maybe seeing a little bit more on that front, maybe some advancements towards real true interoperability. And what I'm really looking for is not really the big announcement, but really more the small use cases where a couple of organizations have gotten together and actually made something happen between the two systems or between the two organizations. I'm looking more for that, and so I'm hoping to see that at the show floor. But I really think that APIs are going to dominate the HIMSS exhibit hall this year.
It's interesting if they do come together and start sharing. Do they want to share that they're sharing? Like that, I don't know. That's kind of an interesting. But I agree with APIs. I think that's actually a really smart prediction. Everyone will be doing API. In fact, maybe the article we'll be writing, the HIMSS headline today is going to be, oh, I met a vendor that didn't have an API.
Right.
The one of 1,300 or however many it's going to be this year, right? So that's a good prediction. But I think you're right, though, that I would probably, if I'm predicting HIMSS 19, I think it's going to be a year for the plumbing. And the plumbing meaning the interoperability, the APIs, the communication systems, the cloud infrastructure, all of those things that connect it are going to be a popular topic and going to be something that everyone's going to be looking to. Because, in the years past, it's been implement the EHR. And now we're like, okay, wait, now we have an EHR. Now what do we do? And I think we need to kind of clean up the plumbing and connect the systems the way we need to make it more efficient. So I'm watching for that. And then, of course, everything's going to be cybersecurity as well. I mean, everywhere we're going to go, because that's on the top of every CIO's mind. That's what keeps them up at night.
Yeah, no, I agree with you on the plumbing thing. I think in the last few years, we've seen a lot around EHR implementation and certainly EHR optimization. But now I think people are realizing, hey, there's all these other systems that support that. We need to really put some focus and put some tooling behind the infrastructure, the security, the server side stuff. I mean, all of that I think is going to be a topic of discussion on the show floor.
Yeah, I mean, I just got a notification about I think it was out of Improvada. They had this Bluetooth empowered with their cell phone that when they walk up to the workstation, it logs in automatically. That's the type of plumbing stuff that's really interesting. And, every doctor that has to log in 300 times a day is going to be loving that type of, simple solution.
Right, and then not to mention how much reduction in frustration that is having to log in every single time, right? Having that system recognize it through Bluetooth, that's pretty awesome. That's a nice UI experience that people would want.
Exactly.
So let's go to the second question, John. So this tweet came out from HIMSS a little while ago. It's talking about machine learning and AI and how 24% of the respondents to their survey said that AI in particular is going to be very helpful and has a potential for a very large impact on population health initiatives.
Yeah, and the reason I like this stat is because AI covers everything, which I guess is kind of a bad thing in some ways. But the reason I like it is that AI can help you understand the data to know who needs your help. AI and machine learning and those types of things, which I think they probably categorized under that machine learning AI umbrella. Those things can be used to understand how to engage the patient. They can know when to engage the patient. They can know on what platform to engage the patient. They can know what message will resonate with the patient. So all of these things can use the data to be able to do the full spectrum of things that are required to do population health appropriately.
Yeah, no, I like where you're going with this, John. I think, and I wrote about this on the HIPMIC site a while ago, where we talked about the changing role of healthcare marketers. And I think one of the things that's going to be, well, hopefully is going to be on the show floor this year is really taking a look at the data, applying AI, and then looking at it from a marketer's point of view to say, how do we look at the behavior of patients, and then how do we message to that? How do we engage them more, as you said, through those different channels? Do we know that email works or doesn't work? Do we know that this segment of the population uses text versus voice versus any other method of communication? Or you know what, they actually do use the portal, heaven forbid. And so let's engage them through there. But using AI to look not just at diagnosis and those kinds of things, which are definitely very popular in the media, but more of the mundane stuff to go, well, what's the best way to reach this person to make sure they come in? What's the best way to reach this person to make sure they pay? All those things I think will be interesting to see. And to me, that's a much more practical implementation of AI because that happens today. That is not something that's rocket science.
And my fear there, though, is there's a lot of CIOs out there that just want to be infrastructure CIOs, if you will. they want to make sure your computers are running, your networks running, your servers are up, and they want to be infrastructure CIOs. But what you just described there, right, was that the CIO needs to understand marketing, or at least needs to collaborate with their marketing people, which, there's this huge wall. I mean, we want to talk about silos, right? Like, we have silos in healthcare, but there's a silo between the CIO and the CMO, the chief marketing officer as well. I don't know. I mean, that's a hard shift for a lot of CIOs to say, hey, let me get involved in the marketing side of things so that my IT products are more effective.
Yeah,
It's tough.
I think it is tough, but I think CIOs are also looking for a win. And AI right now, I'm not sure it's got a lot of big wins out of the belt. Certainly, the technology is very promising. It's going to do a lot of things, but I think today it's still not mainstream enough for well, I'll call it widespread rollout. So I think in marketing, a CIO can score a big win to go, hey, look, we've applied this AI technology to our marketing area. And here's what we got. We got better patient engagement. We got better return. We got better loyalty, higher reviews. You can actually tie it to something tangible and go, see, this is the power of AI. Now let's apply it over here. And now you've got that wind under your belt and can use that as leverage for other projects. So I think some progressive CIOs will see it that way. Certainly, it's not the first thought. I agree with you that it's not the first place you would go to look for some AI applicability would be marketing. But I think there's something there. There's something there.
No, I mean, I think if we're going to achieve value-based reimbursement, we have to connect marketing and IT, right? I mean, those two are essential to achieving the goal of a value-based reimbursement model and really engaging the patients. And so, I mean, I hope that there's more of that happening. It's just, when you see the stuff on the ground, you're like, man, this feels far away.
Well, and last thing I'll say is on this is, there's also other ways to apply AI rather than, again, the diagnosis and some of these other more complex things where you're looking at disease states. I mean, you can actually apply AI to the tickets that you get as a CIO in your support desk to know, hey, maybe I can analyze this to see, is there a pattern emerging here that I can't see in terms of, do people need more training? Is it time to replace a certain piece of infrastructure? There are AI algorithms that are available from some infrastructure players that will actually look at that support desk data and apply some really nice algorithms to give you some predictions as to, hey, you might want to be doing this kind of maintenance in order to reduce your ticket load.
Sure.
That is,
and Protenus does it with EHR audit logs, right? So that's Protenus' solution. We see other ones doing it in cybersecurity, right? Because you can't monitor all your network traffic, so you have to use AI to know what matters, what's the signal, and what's the noise in all the data that's going. So yeah, there's a lot of application for sure.
You got it. And John, we've got quite a lot of sponsors of today's episode.
Yeah, so it's interesting as we preview HIMSS. We've created kind of a new model. So if you'll be attending the HIMSS 19 conference, we like to host this series of meetups on topics. We have a whole series of topics at HIMSS 19 ranging from cybersecurity, healthcare cloud, SDOH, social determinants of health, the importance of nurses, IoT, and healthcare communication. I could go on and on, right? We have this whole series of meetups because we have really something for everyone to come and enjoy and engage, because the best part of every conference from our experience is really engaging with a bunch of smart people. So that's what we're doing with all these meetups, and these are our partners that are helping to organize these meetups with us so that we can bring together a bunch of thought leaders and then other people attending the conference to have a discussion and share ideas and share learnings with whoever comes to present. So if you're interested in this type of meetups, if one of those topics is interesting to you, you can find all the details of those meetups at healthcareittoday.com or also on Twitter at healthcarescene. We'll post a list of meetups. We'll pin it on that account so you can go and see where we'll be at HIMSS, where we're hosting one of these discussions. And the nice thing is, if you come, we try to encourage the audience to ask questions, to contribute ideas. It's not just, hey, come and hear us talk for an hour. It's hey, let's engage for an hour and have a real meaningful discussion around these topics.
Yeah, no, it's always great. I always love these meetups where you get to, see some of the folks who obviously are on Twitter, but also just meeting people who you wouldn't normally meet, the product managers of various companies, thought leaders in other areas. It's a really great way to kind of listen to some people talk, but then also engage in the questioning and engage in the discussion. So it's less, you're right, it's less presentation and more engagement, which, people usually walk away from these meetups going, yeah, I'm glad I really met these people. I had some interesting thoughts, some interesting discussions, and I want to find out more, which is great.
Yeah, we have some great partners who they understand the idea of education, not selling, right? You know what I mean? Like we don't even have to tell them now because we've worked with such good partners. So it really is about education and collaboration and sharing, not, hey, come and buy this product, which, happens far too much. And if you're not at the show, you can also follow along at HIMSS19 hashtag. We'll be live tweeting these meetups as well.
Sounds great. Looking forward to it. So, John, one of the things that we try to do on this podcast and on these radio episodes is really try to give some practical advice to people. And with us being so close to HIMSS, I thought it'd be kind of fun to chat a little bit about some survival tips for attendees at the big show. So, what survival tips have you got for people who are going to go down to Orlando?
Just breathe. That's actually a pretty good tip, slow things down, right? It's just one show and, take a deep breath and slow it down. And, I think at the end of the day, the first tip is, make sure you have your goals clear and your priorities clear about what you want to accomplish. Because if you know what you want to get out of it going in, it'll help you prioritize because there is way too much to do, right? FOMO is alive and well at HIMSS19. You will not see everything, but you can be happy with what you do see. So I think that's, the breathe in, breathe out, take a step back a minute and say, okay, I can't do everything, but what can I accomplish is a really good tip, to start. And, I'll avoid all the wear comfortable shoes, drink lots of water, those types of tips. But here's a good tip for Orlando. And that's, how do you get around? And luckily it's pretty close, but then, a lot of times you want to go off site for some of the parties or events, or maybe your hotel's a little far away. You don't want to wait for the shuttle. So a tip I've found, if I'm at a hotel and I don't want to wait for the shuttle, I'll often take a lift in. Now, when you're getting the lift into the conference center in Orlando, sometimes you hit some massive traffic. And when I say sometimes, I mean you always hit massive traffic. So what I tell my Lyft driver to do is I have them pull up, and once they hit the traffic, I'm basically there. I can see the conference center. I just tell them, hey, I'm getting out, and then I just leave. So, it's really nice, especially if you're doing Lyft or Uber where you're just paying them electronically. It's not a cab. Just have them get to the traffic, get out, walk across the bridge from the, hotel that's across the street, and you're there, before your Lyft would have even made it, or your Uber or whatever you're taking. So that's one tip. And then the other tip is when you're leaving, don't try to take one at the main area. Walk across the street to the hotel across the street and order your Lyft from there. And then you obviously will get one a little quicker and avoid some of the traffic, and, then it helps you out too. So there's a couple tips. And then, of course, if you need some parties, here's my party tip. Just go to Point Orlando and you'll find some. There will be a lot.
There'll be a lot. That's Point Orlando. I think we keep them in business for that whole week, just from the few days that we're there. No, definitely. Those are great tips. I'll add one thing. There is, when I'm in Orlando, the one area I do ask, same thing with you. I ask my Lyft driver and Uber driver to drop me off. There's a sort of a fast food area that's a little bit down from the Rosen Center, which is next door to the convention center. So a lot of times you could be spending about 15 minutes in that traffic trying to make that left turn or the right turn into the drop-off area of HIMSS. So to save yourself some time and to save a lot of headache, ask that driver to drive you sometimes over to that fast food place. I think it's a McDonald's, and just drop you off right there, and you can just walk. It's like a 2 or 3 minute walk just to head in. So it's not that bad. It's not that bad.
Great.
Yeah,
my other tip that I like to give is schedule nothing. No, don't be confused. Don't make your whole schedule nothing, but schedule a couple hours here and there with nothing. That just lets you have some random time to be able to go browse the exhibit hall or to, go to the lounge. HIMSS has a great lounge. I think this year they have a learning lounge as well, where you can get a comfortable seat, you can get off your feet, you can catch your breath, or you can discover something that maybe you didn't plan rigidly into your day, and, discover something that might help your business, that might help your organization.
Right. I will say this, just a tip. I think HIMSS is one of the few places where it's acceptable to be wearing a suit and have a backpack and running shoes. So especially for men and women who like to wear nicer shoes or kind of think they have to, at HIMSS that's okay to wear sneakers because people, you're going to be walking a lot. The other thing I'll recommend, especially for Orlando, unlike Vegas, there are not a lot of food options in Orlando in the convention center. In fact, there's only like 3 or 4. So I would definitely recommend you carry, the sports bars, protein bars, anything like that, because, there are some times where you're just not going to be able to grab lunch, or you're just not going to want those lunch options. So that's the one thing about the Orlando Convention Center is there's nothing really around it, and it's kind of far to walk to get something nice to eat. So definitely would recommend you, have some of that food on you. And that's my recommendation. The other thing I would say, and to kind of give a plug to the people on the fringes of the exhibit hall, I've always found it very valuable to kind of go outside my own comfort zone and kind of just check out some technologies that I may not be maybe in the market for, but that might be kind of cool and kind of different and kind of interesting. And those I find are on the edges of the exhibit hall. Those 10 by 10 booths that are at the back, those 10 by 10 booths that are at the sides. Go and just walk through that aisle and check out what may be there. You may be surprised at what you learn, and will definitely be. I think you'll definitely find that you'll generate a lot of ideas just by seeing what those guys have available.
Yeah, and I think those ones on the edge are often the ones that booked their booths last, and that you can often find some interesting companies that are either just getting into the market or have a unique perspective that you haven't seen other places.
Yeah, I definitely would recommend that. So let's move on to the next one, John. What are some of your success tips for the exhibitors at HIMSS?
So HIMSS is a hard conference, right? 45,000 plus people, 1,300 vendors, somewhere in that neighborhood. I haven't, seen the final numbers for this year, but it's probably going to be somewhere near that. So how do you rise above the noise is really the question. And there's a lot of angles you can take, but I'd say the number one tip I have for HIMSS exhibitors is make sure you train your staff on how to work the booth. If that's your social media person, if that's your salesperson, if that's, your head of infrastructure, they probably don't know how to work the booth, right? And so helping them understand, to what they need to do, how to engage someone, and really just to inspire them about what you have to share with whoever's walking by. I understand that not everyone can be as excited as us, right? That maybe they don't love this stuff like we do, right? I mean, to seize our healthcare IT today, kind of theme. They don't have to necessarily be as passionate about it, but if you train them appropriately, they can come off that way, and that shows in your product, and that can open up new doors. And I think that includes helping them understand, like, hey, you might be a salesperson, and the only person you really want to talk to is someone that you can sell to. But if a press person comes by, or if another influencer comes by, or a consultant comes by, what should they do with that person? Can you, even if it's just a pass off to your PR person, make sure they understand that, because it's a missed opportunity if you don't engage the people that come by in a good way.
Yeah, that's one thing I would definitely recommend that is overlooked by a lot of exhibitors, and that is just to have somebody who can be your spokesperson in the booth at all times, because there's a lot of press. There are a lot of press that walk around, and they sometimes they don't say press on the badge, right? Because sometimes they're exhibitors, or sometimes they just come on a day pass, which they don't have that little tag on them.
So because they want to hide, right?
Because they want to hide. But I can't tell you the number of times that I've walked into a booth now that, having been part of the press corps now for a couple of years, and kind of asked, hey, can I speak to someone about the company? But I'm not a client. I'm with the press, and then it's like a scramble. It's like they don't know who to talk to. It takes them 2 minutes. Sometimes they tell me to come back, which I try to, but it's very unlikely. So it's just a missed opportunity, because all I needed was sort of a quick soundbite, a couple of words on what the company does, maybe what they're showing that's interesting. So it's just unfortunate. So it doesn't always have to be a PR person, but just always have somebody at the booth who's ready to talk to someone who isn't a client, and who's willing to engage and just give those quick sound bites, because you just never know. Podcasters, all these people are roaming the halls around him. So that's my recommendation to exhibitors, one. The second one is, there's no bigger turnoff than seeing a bunch of people standing around in your booth looking at their phones. And that to me is the number one turnoff, because you could have the most beautiful booth, but if half your people are sitting around looking at their phone, it's, why would I come into your booth? Clearly they're more occupied looking at their phone. So I get it. You have to go and check your email. You have to do those things. Do that outside your booth. Walk down the aisle a little bit, or take a walk and do it while you're walking. Yep. Do something like that. But I can tell you that I watch attendees as they walk by the booth, and if they see more than half of the people on their phone, they just turn around and walk the other way. So that kind of goes along the lines of your training. So those are two sort of in-booth things that I would recommend.
Yeah, I mean, I think the other one that's valuable is, think about the relationships you're doing. I mean, even if you're getting this, a couple weeks out of HIMSS, look at what people are doing. Many of the press are broadcasting what they're looking for, or they're broadcasting where they'll be. Many of the, the customers will do that. I know David Chow at one point last year, he tweeted out, he said, "Hey, I'm going to be here for an hour. Anyone that wants to stop by, come by." He's a CIO at a children's hospital. What a great opportunity that you could go and, build that relationship with him and stop by. So, think about who are the people you want to create relationships with, and start building a relationship. So don't go at it as how can I pitch them something? Say, how can I build a relationship with them? And that will change the kind of experience that you have.
No, you're definitely very right on that whole relationship thing. It's not all about selling at HIMSS. I mean, I know we all love to land that big deal, but I think, it's more about forging a new relationship or furthering an existing one. So it's really more about connecting. And when you're connecting with someone, you don't immediately run up and say, "Hi, I'd like to pitch you. This is what I have to offer, blah, 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 blah." You don't do that, right?
I'm sure that's effective, right? No.
I'm sure it's very effective. No, but it's stopping someone and just having a conversation. "Hey, thanks for stopping by the booth. What are you finding that's interesting at HIMSS?" Get a little bit of information, start a little dialogue. What have you noticed about the show that's different from maybe last year, if you think they've been to HIMSS a few times? I've done it a lot of times where if I'm lined up at the Starbucks line, I'll just start talking to the person behind me and go, "Hey, what are you thinking about HIMSS? Have you seen anything interesting? Can you point me to something that you liked?" And that just starts that conversation. And even if it turns out that they're a fellow vendor, or if they're a press person and they're never going to do a deal, that's fine. At least you're starting that conversation. And it's funny, you'll hear other people start joining in. The other person behind them will start, "Well, I saw this. You might want to check this out." You'll get some really good information, and that's how you start these relationships. So, don't just, kind of stand in your booth and just do that. You'll walk around, engage some people in conversations, and I think you'll definitely walk away from HIMSS with a few new prospects that you can engage with after the show is over. And speaking
I asked the question, has anyone sold anything off a badge scan?
Yeah, it is a rare one. It is a rare one. But I will say that. So, John, we are out of time, and we're going to be very, very busy very, very soon in Orlando at HIMSS, and I'm looking forward to it. So, thank you to all of you who tuned in this episode of Healthcare IT Today. For more details about the show and on the check out the programs page on healthcarenowradio.com and on Twitter at #HITSM. John and I will both be at HIMSS in Orlando. Check out the healthcareittoday.com website for the article that will show where we're going to be, all the meetups that we mentioned, and all the activities we're going to have. And also make sure you follow the two hashtags, HITSM and HIMSS19. I'm Colin Hung, and this is my partner, John Lynn. Until next time, have a great week.